Hello and welcome to today's video. In today's video we are going to talk about rheumatoid arthritis. Don't forget to like and subscribe to this channel at the end of the video if you like it, and leave a comment below if you want to, and let's get straight on to it. So rheumatoid arthritis is an autoimmune disease where the cells in your joints and generally attacked by their own immune system, which causes mainly swelling, stiffness, pain, and over time it can cause quite a lot of damage to the joint, which in a worst case scenario you need to be replaced, but that is something down the line. Some of the risk factors for rheumatoid arthritis are your sex. Unfortunately, women are more likely than men to develop this condition. Age. Rheumatoid can happen at any age, but generally it tends to get worse. It tends to be more common, I would say, around the middle age. Obviously, the next risk factor will be family history. If there's a family member that have rheumatoid arthritis, unfortunately there's an increased chance that the next, the child, the daughter, or whatever, is likely to develop rheumatoid arthritis or RA. Smoking is also a risk factor, and being overweight, or in this case obesity, really. So the next question to think about is, how do patients present? Now, the main symptoms that we present with is swelling and stiffness of the joint, which gradually gets worse as the patient, ages or stuff like that. Now, this condition generally affects small joints like the hands and the feet, but theoretically speaking, it can affect any joint, such as the hip or any other joint. Now, the pain is often described as a throbbing pain, but everything varies by patient and the risk factor we discuss about. And the main symptoms, like we discussed, is stiffness. And what I mean by stiffness is that the patient, for example, is not able to bend their hand fully or form a fist. So it's good to do like a quick hand examination if you're seeing the patient face to face. Another feature that this patient will present with is that the stiffness is worse in the morning, and this is quite important. It lasts more than 30 minutes, while with osteoarthritis, the pain generally gets better with movement, and it should last less than 30 minutes, but each patient presents with different type of scenarios. So if you take into account the joint of the hand, for example, the MCP and the PIP joints are the one mainly affected, and on examination you would notice like a swelling, which are called nodules, which tend to develop in the affected joints. Now, systemic symptoms would be tiredness, poor appetite, weight loss, temperature, all this kind of like non-systemic, not quite vague symptoms. So you need to have a good history. So now let's move on to investigations. Now, definite diagnosis is done by a rheumatologist. So a GP will do some bloods, do a basic hand examination, see what they can see. If they suspect rheumatoid arthritis, they'll do some bloods and then refer the patient to the rheumatologist, sometimes after they tried some treatment in GP practice, or unless the patient presents really at a late stage of rheumatoid arthritis. So in regards to the bloods you want to order, the ones I normally order is CPR, ESR, and sometimes this may be normal though, so just keep that in the back of your mind. Sometimes the patient will present with symptoms of anemia, so you do the full blood count, B12, ferritin, folate, and they may present anemic, because again the risk factor is that they are females. You can add rheumatoid factor as a blood test. It's not really specific, but that could help. A more specific blood test is the anti-CCP. That should be raised with rheumatoid arthritis, but sometimes that can also be normal. Then you can add like LFTs and Usenis. I found it also quite useful to do an X-ray, which you will see damage to the joint, kind of like erosion of the tissue, and all these things point you towards the diagnosis of rheumatoid arthritis. But like we said, the main diagnosis is done by the rheumatologist, which if you work in a GP setting or even in the hospital, you just refer them to a rheumatologist. And let's talk about management. Now, this is a bit tricky to manage a patient that you don't have a clear diagnosis of rheumatoid arthritis, and maybe they're still undergoing investigations. Now, you can start with some simple painkillers like paracetamol, naproxen, ibuprofen. I don't think they use diclofenac anymore, but yeah, it's part of the NSAIDs. Non-steroidal. You can use some weak opioids. Obviously, if the patient is elderly, you have to warn them about constipation with opioid like codeine, cocodamol. But as I said, the main management is done by the rheumatologist, and they will decide if they want to start the patient on specialist drugs, such as disease-modifying anti-rheumatic drugs. That was a mouthful. Or DMARD. Oh, thank God. And the main ones I've seen being used, such as methotrexate, sulfasalazine, rituximab, and so forth. Anyway, this immune suppressing medication, I would say. But I also find it quite useful to refer patients to a physiotherapist. Actually, a good physiotherapist can actually diagnose a patient with rheumatoid arthritis. I've had cases of physiotherapists diagnosing a patient with juvenile rheumatoid arthritis, which is obviously quite debilitating for the patient, but a good physiotherapist can be of very good use for diagnosis and management of the joints, aches and pain. And so that's it for this video. I hope you guys enjoyed it. Don't forget to like and subscribe, and leave a comment below if you have any questions, any suggestions for my next video, and I'll see you guys in the next one. Have a good day.